Assalamu alaikum, everyone. Welcome back to the Career Guidance Series, Saudi Arabia. I hope you all are having a wonderful day. So my name is Ismail Shakir. I'm a graduate of the College of Medicine, Alfaisal University. And I'm also the founder of the Alfaisal MedHub platform here at Alfaisal University College of Medicine, and I'm honored to be the host for today. For those of you who do not know what Alfaisal MedHub is an initiative under the umbrella of the International Office College of Medicine that really aims to create an online global community of medical students. Alfaisal MedHub, covers a broad range of topics that are common to all medical students all around the world. Our primary objective here at Alfaisal MedHub is to really help medical students learn more about the career opportunities available to them after graduating, as well as the steps involved in pursuing them. And for today's webinar, we have a very respected doctor of ours, Dr. Mohamed Amir Mrad, who is a consultant plastic and craniofacial surgeon. He at King Faisal Specialist Hospital and Research Center in Riyadh, Saudi Arabia. He is the former program director and current deputy program director of the plastic surgery residency program. He is also an associate professor at Alfaisal University College of Medicine. Dr. Murad, after graduating from the University of Toronto, he completed 3 years of craniofacial fellowship at the University of Toronto and at Harvard University. His main surgical focus is on facial reconstruction and aesthetics. Dr. Murad's contribution to the field also includes co-authoring of the book Clinical Diagnosis in Plastic Surgery, the second edition of the Atlas of Facial Implants. In addition to that, he's also published several chapters and more than 40 research articles. We also have with us Dr. Eman Alshammari, who is a PGY1 plastic surgery resident at King Faisal Specialist Hospital and Research Center. And both of them collectively will be answering the questions on plastic surgery residency applications and interviews today from the lens of a program director and as well as a plastic surgery resident, inshallah. So moving swiftly to the questions. So the first question is, could you give us an overview of surgery as a field and surgery residency in Saudi Arabia?
You're talking to me, I guess?
As you see fit, Doc.
Okay. Hello, everyone. I would like to thank Alfaisal University for this invitation. And it's a really great initiative. And I think we're missing this in a lot of institutes. People graduate and they need some guidance. I didn't have this guidance when I graduated. And we'll hear from Eman as well. Eman is an excellent resident with us at King Faisal Specialist Hospital. She went through the process last year. She has an update again for this year on how to apply to plastic surgery. So I'll just give you an overview of surgery in general, and then we'll go specifically with the plastic surgery. So in general, when you come and graduate from medical school, you are faced with a lot of specialties. I mean, you can't imagine how many specialties are out there and subspecialties following these specialties. You need to think, am I a medical doctor or a surgical doctor from the get-go? Or I'm an imaging doctor, or I'm a pathology doctor. I don't want to interact with patients at all. I want to interact with slides or screens. That's a different ballgame. But I think the majority has to decide whether it's surgical or not. The main difference that I see between surgery and medicine is when do you see the results? So, as you all know, medicine takes time for people to heal and to show the results of the medications that you give. You follow up your patients every 6 months or more, and it's a long process. And you need to be able to interact with the patients on regular basis, more than the surgeons. I don't say we don't interact with patients, but we usually like our patients sleeping on the bed, on the OR table, before we proceed with our specialty. So it's either surgery with immediate results. You have an appendix, the appendix is out, you go home. You have a gallbladder stone, we remove the stone, you go home. Plastic surgery, you have a crooked nose, we'll fix your nose, you go home. You have a cleft lip, God forbid, as a baby, we fix the cleft lip, we connect your lip, you're more normal, you go home. So we have immediate results in comparison to the other specialties. I think that's a good overview of the whole surgical specialty. If I go specifically into plastic surgery, we are, I won't say but I think plastic surgeons in general are more obsessed with details, whether in reconstruction or cosmetic practice. We like the variety. So we always compare ourselves to cardiac surgeons. Cardiac surgeons have, we say, 3 operations. I think they have more, but the 3 operations, cardiac transplant, what do you call them? Coronary artery bypass. So it's a very specific field with one organ that you work on. In plastics, we work on all organs and we work with all our colleagues. For example, a patient who has a cancer on the mandible, the ENT surgeon will come and remove that part, and we will reconstruct that part with a bone and skin from their legs and reconstruct this whole area. So we dealt with the bone, we dealt with part of the tongue, we dealt with the cheek. So we deal with all the body. We deal with hand operations, tendons, nerves, vessels. We deal with eyelids. We deal with, you name it. We can replace a trachea if we need to. So that's the main role of plastic surgeons. And very few people understand our specialty, unfortunately. And for people who understand it, they know that we really help around with our colleagues. I think that's a good overview. And we can move on to the next question, and then we can have some questions at the end from the participants.
Wonderful. The next question says, what are the advantages of being a surgeon?
Advantages of being a surgeon. Good question. It just shows you that I wasn't prepared for the questions. But anyways, advantages of being surgeons, I think, to see immediate results, to be in control most of the time, to be helpful to other people, to help people in need. Lifestyle differs among surgeons. I think medical people have slightly better lifestyle since there are no emergencies as in our specialty where you need to operate at the middle of the night, for example. In medicine, they have the luxury of maybe postponing to the day after or something, unless it's something urgent. But I think our urgencies are much more, and most of the urgencies of the medical field or other specialties can be taken care of by the team rather than the surgeon. But in surgery, you need to be there yourself because it's an operation that is needed and you're the specialist in it. So there are advantages, but then there are disadvantages. I hope that's not the next question, is it?
Yeah, I think that's a very good answer. So Dr. Mrad, as a follow-up question, do you think specialty is sort of related to the personality as well? Do you think surgeons have a particular personality versus those who get into the medical field?
Definitely. We are people who like to see immediate results. We are people who like to be in control of the situation that we're dealing with. We're always on the edge. Our medical friends are much more relaxed. They go by the book. They can read about the problem before they come and fix it. It's a much different specialty and personality, definitely, between both.
That really answers the question. Thank you. Right. The next question then says, why does it get stuck? Okay. So some would argue that surgery is going to become saturated in the main cities in Saudi Arabia within the next 3 to 4 years. What are your thoughts on that?
That's a very good question. I think if you're good at what you do, you don't care about the saturation. You don't care about the saturation. Because maybe there are 1,000 surgeons out there. Let's talk about another specialty. There's 1,000 general surgeon in Saudi Arabia or in Riyadh per se. But if you're good, people will come to you. So you need to work on who you are, what you do, the way you do it, and not worry about the number of people around you. You know what I mean? There are in every street in Riyadh, there are 20 burger stores, right?
Right.
But then there are those that are premium. There are those that when you go to that restaurant, you just talk about that restaurant for the rest of your life, and people will go to that restaurant more than the other restaurants. So I don't worry, or people, the students and the residents should not worry about the number of surgeons out there. You just need to excel in what you do in the best way possible, and then everything else will collaborate, will go into equilibrium at some point of time, and the good surgeons will sustain, and the not so good surgeons will find another specialty or go into business or leave that for you. So just focus on what you. The saturation or not saturation is not our business. It's a higher authority business, and you just worry about what you can do in the best way possible.
I think that makes wonderful advice for our, applicants this year, and even the junior, students thinking about surgery. Moving to the next question. So what do you look for in surgery residency applicants?
Okay. What do we look for in surgery residency applicants? Are we going to ask about? Are we going to talk about the application process as well at some point, or because this is a little bit more advanced than the application process?
Yes, I mean, we can definitely touch upon that. If you feel that you would want to talk about the application process first, we could talk about that first.
Okay, so I think it's better to take the students into the sequence of events that happens. And here I would like to ask Eman to help us. What did you do when you applied for residency? How you applied, the Saudi Council regulations? What did you do before you came and met us at a later stage?
So Dr. Eman, so we'd like to hear from you. So our junior applicants or your junior colleagues would like to know, what was your journey like? Before you got into, a plastic surgery residency program, how did you prepare as an applicant? How did you, find Dr. Mrad and his plastic surgery residency program?
Hello, good afternoon. I'm happy to be today with you. Inshallah, I will start with first of all, when you apply for residency, you should, during the internship, take an elective in a plastic surgery. It's different from university to other university. Some university, 2 months or 3 months electives. Try to take it in the center you want it, you are dreaming to be on it, and show interest, attend early, make everyone knows you, and it's just do what that should you do. Then there is a online application. It's open this year in 9 January. There is a 20 points. That's the matching to be taken. It's a research activity. It should be published one research, and another research participate as an editor. Postgrad education academic degree for 2 points. Volunteer in the social public academic activity, it's for 5 points, 2 points for each. You need to prepare 2. Strong interest, when you put 3 cities, the first the first selected cities, in the same choice, like plastic surgery in Riyadh, Jeddah, then Mecca, you get 3 points. After that, if you unmatch in the internship and you take a clinical experience for 6 months, you will get 2 extra points. And if you are currently employed, you will get 2 points. Then the match result came. And then you will be in the list for nominated resident, and you will apply for an interview, and all the centers in the nominated city.
Right.
Thank you.
Ismail, I'll just ask a few questions to Eman. Eman, does the research have to be in plastic surgery for you to be accepted in the plastic surgery program?
No.
Okay.
Any published, it should be 2 research, published research, and another research unpublished.
1 published and 1 unpublished research in any field, not
any field, yes. Not
okay. The other question, actually a comment on the electives that you said that you have to do you have to do electives in that field to get points for it, or you're saying this is something good that you should do?
That's something good. You have to do it.
There are no points for it.
No point. No point only for the cities. Like you put the first city Riyadh in plastic surgery, then Jeddah, then 3. This is you will get extra 3 points. This is a strong interest. This is only the thing related to the plastic surgery.
And what about if you apply to other cities other than the main cities? Don't you get more points?
No. It should be the first 3 choice, the same specialty in the 3 cities. Like plastic surgery in Jeddah, plastic surgery in Riyadh, plastic surgery in Mecca.
Okay, got you. If it's the same specialty, then you get those points. If you put plastic surgery in Riyadh, ophthalmology in Jeddah, you don't get those points.
You will not get this point, yes.
Okay. So amazing planning. I will only add 1 point to the elective, okay? And this is since I was a resident, okay?
It was previous. There is the point for research. It should be in the same specialty, but they remove it in this year.
Okay. Because I think it's sometimes difficult for people to get into that elective, and then it will decide your future career. My advice, if you don't get the elective in plastic surgery, or if you get it, try to limit it. I'm not pro for a longer elective period in the specialty that you're applying for. I think you need to be yourself, because if you're organized, if you're hardworking, it will show. Okay, and that's what you've shown during your electives. And when you come and apply to the program, I want to be able to remember you. I want you to be with us for a specific period of time, for me to remember your name and not remember any mistake that you've done. So I think the magic number is 3 weeks. If it's less than 3 weeks, I will not be able to remember your name. If it's more than 3 weeks, there's a big chance that you might do a mistake, or you get on the nerves of another resident that you're working with, or you know what I mean. So I think 3 weeks is good. If you know that you're a good person, then 4 or like a month is okay. Like you said, show your interest. I don't want you to be like excellent in your class and very knowledgeable, but then come to the operating room and stand next to me and be very quiet. I want you to talk, and I want you to talk sense, and I want to feel that interest, okay? So that I would remember your name. Oh yeah, when you come to the interview, I have the names. Oh yeah, Eman, I remember she worked with us, and I remember she was excellent. She attended the rounds in the morning. She updated me on my patients. And if it's not me, it's the residents as well. It's the chief resident who's holding the unit. They need to know that you're good. It's not an act. Don't act, because acting will be caught at some point of your application, whether before in your numbers or whether during the interview. If I feel that there's something fishy in what we're listening or hearing to or listening to, and it better show during that period of time. You don't want it to show later when you're R1 or R2 and you're a failure, God forbid, and then it's a major problem because you've wasted a year or two of your of your time, and you have to go for another specialty. So if you really love what you're doing, hopefully you'll be good at it. So these are my 2 points about electives. I think I saw a question about how can I take an elective in plastic surgery or something. It doesn't have to be a what do you call it? An elective rotation that is based on your internship. It could be a summer rotation. It doesn't have to be, if there's only a maximum number of students that we can take through a year to evaluate them, or interns. But you can come in the summer, you can join another program, and hopefully if you apply to our program, the doctor who you've worked with in that other program can call us and tell us, oh, Dr. So-and-so is excellent, please look at her papers or something, There are always references in any job out there, but you really have to be good for us to accept you. I think these are my 2 points.
Thank you, Dr. Mrad. So there is one question that arises, is that some students actually. So what we were talking so far is part of the internship. So some students might want to do an elective after their 4th year. So after their 5th year, they get into internship, but after their 4th year, they have this summer. Maybe they're preparing for the SMLE exam. Maybe they are doing some other things. But the question arises that is it valuable to spend a month or two doing a plastic surgery elective?
It's valuable to do a month, but the problem is you don't want to do it too young in your career, in your university years, because first, I'm not sure if you know what you want at that point of time, number one. Number two, you haven't read enough about it that you might fall into a problem if I ask you a question in the operating room and you're like, I don't know what's a graft. You need to be prepared for the electives as well, because you don't know who you will meet and what they'll ask you during your elective period.
That is a fair answer.
Yes,
there's
one thing I want to add. It does not mean that if you don't do an elective with us, that you won't be accepted. And that's why the Saudi Council removed that from the interview. I think further down the road, we'll talk about what we look for, or is this the question, what we look for during the interview?
Yeah, so there are more, there is a question in that, about that, about the interview.
So,
Okay, so then moving to the next question, we have, when evaluating applications, what is the most important aspect of the application for you, and what are the common red flags? In terms of the application, then there is a follow-up question on interview. So are there any important in the application itself, for example, in the CV that you're looking for, and what are the red flags in the CV?
Okay, good point. To tell you the truth, the Saudi Council did a great job trying to standardize the application process. There's little effect for the application on me when the person comes and attend the interview with us. I personally, I don't try to look for problems in the application. I try to look into the person himself or herself. Like when they come and sit in front of us, I really want to get a sense of, is this person genuine, or are they acting? What are they after? Do they want really to help humanity? These programs are medical programs, and we're doing it to help patients. Okay, so I really want to know, is this person just looking for a job, or are they looking to help, or are they looking for the good in life? And it almost always shows. And mashallah, Iman, we're so lucky to have chosen her. I'm not saying her colleagues are not the best. Of course, there's also the matching system. We'll talk about this maybe later on. But if I want to say about a red flag that people should not do, but again, it's not always in your control. But I don't want to see a person who doesn't really know what they want. They've done their research in emergency medicine. They've done their electives in gynecology, and they're applying for plastic surgery. That confuses everything. I'm much more lenient towards a person who did his electives in plastic surgery, did his research in plastic surgery, their whole CV is about that specialty. Then I really know that this person is interested and hopefully will have a great future with us. Again, it doesn't mean that the other person, because it might be out of luck, or they did not have an elective with a plastic surgeon to be able to do research in plastic surgery. So we take that into consideration, and we ask them during the interview, why is all your research about ophthalmology? Doctor, I was initially interested in ophthalmology, but then later on I did an elective in plastic surgery, or something happened in their life and they changed. We take that into consideration. But if they don't have an answer, well, I don't know what to do, I want to try plastic surgery. We don't want people to try plastic surgery. You know what I mean?
Yeah, I think that sets good basis to understanding for that. Okay, so the next question then says, how much do exam scores, including the SMLE, GPA, and clerkship grades matter?
Okay, so this is part of the application process where the Saudi Council will have limits and numbers for you to get to the interview table. Okay, it has little effect on us. Someone who got a 98 on the GPA and another person who got a 97, it's not a big difference. You know what I mean? We won't have a person who got 75 or just barely passed, because these criteria are set by the Saudi Council. So all these numbers are cleared before the person comes to our to the table, I would say, to the interview table. And it has, to me, it has little effect. It just tells me that person is really a hardworking person or not, but it doesn't matter, because, you know, universities differ and we're taking applicants from all over Saudi Arabia. You know what I mean? So maybe the university in Yamba or Hail is much more difficult than Riyadh, or vice versa, or whatever. So it doesn't make a big difference to us. I have to be honest.
Thank you. So then what are the do's and don'ts when it comes to the CV? Is there something specifically that applicants need to be careful about?
If you, like I said, if you can be more straightforward in your application, you did your electives in plastic surgery, you did everything. Don't be shy to show who you really are. We look at interest as well. We don't look at only your CV from a research point of view, or from an elective point of view, or from a GP point of view. We look at the interests. And we don't want to see all the residents applying saying, I love reading, I love computer, and I love soccer or something. I want to really, I think I'm more interested in people who are different, they have a life. It's not only medicine that they worry about. I want a person who will continue doing what they're doing in the best way possible. I'm interested in horseback riding. I'm interested in 3D printing. say who you really are in your CV. Don't try to hide who you are, because we will know. We'll get to you at some point.
The applicants really need to be careful from your doc.
Yeah.
Okay, so how many references would be a good number to include in a CV?
I think 2 to 3 in that specialty is excellent. More than this, I don't know what you're saying. You're just telling me that you've impressed a lot of people. But if you impress 3 very important people, or very, I won't say influential, their opinion is well accepted around, you know what I mean? But if you go to someone who we never heard of, not well known in the field of plastic surgery, I think we'll have to do more research into that by calling that person and really knowing who they are, and you know what they've seen from you as an applicant, to better understand your situation. But on the other hand, if you have worked with the program director or the head of department or the vice program director or the previous program director, I'm not saying me specifically, there are many program directors, they're well-known people who are in the field and who are, like I said, I don't say influential, but they would say their word is worth something, right? They can really give you a reference for what you've done. And don't ask for a reference if you're not, you know, I have students who come to me and I've seen them maybe one time through the month, and they say, like, Dr. Mrad, can I have a reference letter from you? I don't know you. We've only worked once. I can't evaluate you. I can't give you a reference letter. So I think 3 is a good number.
Okay, thank you. So what do you like to see in someone's extracurricular activities, and how much do they add to someone's application?
We need to see people who are interested in life in general. They have hobbies, real hobbies. I don't want to see in the reference, unless you really you read novels and all that, then I love reading. Otherwise, I want to really see who you are. I want to see. I'm good in cooking. I like cooking, for example. I don't, but I mean the applicant. Then put that. I like cooking. Okay, wow, they're interested in other things than plastic surgery. They won't be bored throughout residency by doing these other activities.
And how would you rate, you know, community service, the importance of community service, you know, for example, awareness campaigns, you know, these sort of activities? How do you rate them in someone's CV? Are they more important? Mm-hmm.
They are part of the application process, and you get points for them. Okay, I think whatever you do in that you know, part of the application is excellent. It doesn't have to be in plastic surgery. It can be in anything. It can be in diabetes. It can be in smoking. But you have to do something for that purpose, for life in general. We still do it till this day. As a consultant, we help in the community.
Wonderful. So how important is research, and what do you look for in terms of an applicant's research experience? I think we might have answered a bit of this.
Yeah, I think we've answered it. In research, I want it to be in plastic surgery, preferably. If not, I want it to be in another specialty as a good, well-written research. I want the material that you've published to be good. You know, I just don't want you to do it just to do it for the sake of the application. You want to do it because you're really interested in doing and helping in that field.
Okay. So how would you view research that is not surgery related?
Like medical related, for example?
Probably, yes.
Yeah.
Say nephrology.
It's still research. It's still research. I said, you know, try to make it into the field that you're applying to. If you couldn't, just get those points, and let's see you in the interview, and hopefully you get it if God intended it to be your specialty, inshallah.
Inshallah. So is it a must to have a research publication?
Yes. Plastic surgery and also other surgical specialties are not easy specialties that you can get into easily. So you need every single point that can help you to get into it. And research is part of the application process. So definitely you need to have some research to be able just to get to the interview. Because without research, I doubt you can get to the interview.
Yes, totally makes sense. So what do you look for in an interviewee, and how can someone stand out during interviews? And on the other hand, what are some of the red flags in an interview?
Okay. What we like in an interviewee, we like them to be honest, okay? We like them to be reliable. We like them to be outspoken, We don't like them to be shy. We don't want to feel anything hidden behind the interview. I want you to be yourself, okay? And that's what we saw in Eman. And we saw it in her colleague, but then the matching process got Eman in. But when Eman came to the interview, she was very honest, okay? She was very humble. She had, good numbers in her papers and her application. And alhamdulillah, we were able to see that in her and to accept her into the program. Well, alhamdulillah, now we saw that, alhamdulillah, we did the right choice, and hopefully she continued in the same manner. But that's what we look for in that person. Honesty, it shows. It shows when you're lying, when you're hiding something. And you need to be humble, okay? I don't want to feel like I'm interviewing another consultant, okay? We are consultants and you are students or residents who are applying to the program. It's not a competition between me and you, okay? You need to be careful about your language sometimes, okay? For example, I'd ask someone, or my colleague will ask someone, so which university did you go to? And they say Hayel, and then the other person in the room was not listening very well by mistake, and they ask after a minute or so what university did you go to? Out of respect, you say, I went to Hayel University. You shouldn't say, as I mentioned, or as I said. That's very bad, I think. I think it's very bad. Be humble. Don't sit in front of me with full of arrogance. I've done 30 research. I'm, as if you have already conquered the interview and you're accepted. We don't like people who don't need us, right? Who don't need the 5 years of experience. I think that's mainly it.
Wonderful, thank you. So then what are some of the questions applicants should avoid when it comes to the end of the interview, when you ask applicants if they have any questions?
That's a good question. That's a good question about questions. You have to be, like I said, honesty is part of it. So honesty, I want you to ask your real questions that you want to ask. I can't stop you from asking the questions that really come to your mind. I would be very careful if you ask me about things that are already obvious, okay? How much is my pay through the year? What are the working hours like? There are rules and regulations that we are following. So you asking these questions, it's a bit, sorry to say this, but it's a bit dumb to ask such questions that are very apparent. You need to come to the interview well prepared, and you know all the rules and regulations of residency to be able to get to that limit, to that stage. I can't tell you what to ask us. And I can't remember what questions were. Eman, can you help us? Do you remember the question you asked us at the end of the interview?
Yes, I remember. I asked you about did you give the resident the facility to represent the department in outside conference or outside activity? Also, did you give the chance to the residents to take elective outside like in Canada?
Yeah. So these are genuine questions. Eman is interested in doing an elective outside. Eman is interested in representing the department or the section outside. That's excellent, you know. Eman didn't ask us, is there a chance that I can do research with you guys? Of course there is a chance for you to do research, okay? Why did you ask this question? Like all the other interviewees that asked this question. But it's when it's genuine and it's different, then we know that it's a real question. Don't copy and paste those questions out there, you know? And don't ask questions that you know the answer to.
Yes, like the question. Yes, like how many on-calls, what's the salary, how many residents you will accept this year, and what's my ranking. You should not ask this question.
Yes, excellent, excellent.
That was informative. So what are your thoughts on post-interview communication, such as, thank you emails?
Doesn't make a difference at all. I wouldn't advise that, to be honest. I wouldn't advise that. It won't change the course of the interview at all.
Okay. So how much weight do letters of recommendation hold, and what makes a strong letter of recommendation?
It depends on who wrote the recommendation letter. It depends on the language of that recommendation letter. Yeah, weight, not too much, but of course, if someone wrote a letter, I remember a resident when we were abroad who did an elective, I think 3 months outside Saudi Arabia, and at the end, he was once called during that period of 3 months to come to help the on-call resident, and he didn't come. So the on-call resident told the consultant. So the consultant wrote the letter to him at the end of the rotation. Dr. So-and-so was excellent. He was a great resident. And this is not in plastic surgery. I'm not specifying someone per se. But they wrote everything excellent about this guy. And then at the end, unfortunately, he missed one of the calls during his rotation. Done. That elective letter, that recommendation letter killed him. So just be careful. If it's a bad letter, don't put it. If it's a bad judgment, don't put it. Hopefully, you all get good letters and good judgment from the doctors you work with. The weight, not too much, unless it's negative, of course, and that's a disaster.
So, Dr. Mrad, then what do you think about electives done abroad? For example, some students do electives in the United States. Because sometimes they are, thinking also to apply to the US residency program. So, they just want to do some electives abroad, let's say in plastic surgery itself, and they use those electives part of their application and those letters of recommendation.
You need to be careful with that. In the old days, my days, it was okay to apply to Saudi and Canada and maybe go to Canada. The country was in need for both programs. Nowadays, it's very different. And we want people who are really interested in our program in Saudi Arabia. So when you show me an elective or a few electives and all of your recommendation letters are from abroad, then I'm worried that I will take you in my program for a year or two, and then you would say, goodbye, I'm going abroad. It's better to be more decisive nowadays from the beginning. I either apply abroad or apply locally. One should not be a backup to the other one.
Thank you. So how important is it that the applicant gets a letter of recommendation from someone in the specialty they are applying for? And is it fine if someone submits letters of recommendation from physicians in other specialties?
Both are fine. You can get them from plastic surgery. You can get them from any specialty, as long as, like I said, it's a good letter. It tells me about you as a person, and you didn't, do something negative in that condition.
Wonderful. I think we have one or two more questions left only. So is there such a thing as a letter that is too old? For example, a letter of recommendation from 2 years ago.
Not really. Not really. A recommendation letter is a recommendation letter, I doubt that a person will change in a few years. Let me ask Eman about this, because this will be very helpful to the participants. Eman, what electives did you do, and who wrote you the recommendation letters?
I took elective in plastic surgery. I took from King Fahad Medical City, from Dr. Ghazi, also from Dr. Bandar Al-Atan. Also, I took in my city, Hail, from Dr. Moli, she's plastic surgery consultant. Also, I have all the letters for recommendation, and it's okay. I put it even if the consultant is not here. Like Dr. Mohammed, he's consultant plastic surgery. I took it when I was in fourth year, and I put it in my CV.
Excellent. So just to tell you, Ismail, and the participants, who are these people? So both Ghazi and Bandar are my friends. Bandar is the first graduate of the Saudi program. Ghazi is my colleague. We did our exams together in Canada when we finished. And so these are people that we know, me and my colleagues in the plastic surgery, but we know them. So when we read these letters, we know the language, we know everything. Dr. Moli, on the other hand, from Hail, I don't know her. I'm sure she's a great surgeon. We read that letter and we took it into consideration. But in all sense, all these letters were positive, and they reinforced what we saw from Eman in the interview. You know what I mean? It's not like I saw something good in Eman and then I read something bad in that paper, whether from a plastic surgeon that I know, or a plastic surgeon that I don't know, or from another specialty.
Okay. So do you have any advice for unmatched applicants to improve their odds for the coming year, for the next match?
That's a very difficult question. That's a very difficult question. I must say that plastic surgery is one of those specialties that they have limited seats. We have limited seats, okay? For example, I think this year we have 7 seats in Riyadh. In comparison to general surgery, I think they have 50. So you can imagine how difficult it is to get those 7 seats in comparison to 50 or more. I don't know how many applicants are there in general surgery. So it's a difficult specialty to go into. If your numbers are not good enough to get you to the interview, then you definitely have to work on those numbers. I'm not sure about the rules and regulations, but I think we have to, when you apply as a second time, we need to look into why we weren't you accepted in the first time. Was it a lack of research? Was it lack of interest? We need to look into that and then try to match you with the people who are applying at that time for the first time. Yes, you got your chance and you didn't get it first time, but everyone can get another chance, okay? The chairs, we can have more positions the year after. Maybe you want to look into applying to to apply abroad. If you didn't have, you were unlucky in matching in Saudi. to change the specialty is something very difficult, especially if you're really interested in that specialty. But if you try once or twice or 3 times and it doesn't work, maybe God is saying something to you, is telling you, look somewhere else. Maybe it's not plastic surgery. Maybe if you become a plastic surgeon, you won't be happy. You know what I mean? It might be something else that will change your life. You never know. And there are many very successful stories. And I truly believe that if you are good in one thing, if you're good in what you're doing, you'll excel, no matter what specialty it is. Of course, when you love the specialty, it makes it easier. So it's a very difficult question, Ismail. It's a very difficult question. And I think you have to just look at the signs. Look at the signs around you. And maybe it's another specialty that can blend into plastic surgery at some point of time. For example, if you're interested in the cosmetic part of plastic surgery, we all know that there's recon and cosmetics. Let's say you're interested in the cosmetic part, you can go into ENT, ear, nose, and throat. There's a new acronym for it. I think it's OLR. Anyways, so you can go into that and then do rhinoplasties, for example, or facial plastics. If you're interested in the reconstruction part, then maybe you can go into surgery and then do breast surgery and then do breast reconstruction fellowships and then do that from that point of view. Or you can do hand through orthopedic surgery. There are many specialties that connect to plastic surgery at some point of time in the future. And like I said, if you're good at what you do, no matter what specialty, you'll be good.
I think that really answers the question. And then there was one question before we get to this from the audience. There's Noora Lanazi. She asks, if I got a letter of reference 2 years ago and I came to the interview, would they ask me, why do you think that the doctor remembers you?
Why do you think that doctor remembers you?
The one who wrote the reference letter.
Do you think that doctor remembers you? Is that the question?
Doctor will remember. Yes.
That's okay. That's an okay question. It's a bit tricky. And it depends on your personality and how you answer this. So if you say, I hope so, it was an excellent elective, change the question to something positive if you can. I did an excellent elective. I did a month. I held 2 on-calls or 3 on-calls. I gave a lecture. I'm sure they remember. Okay, for example, turn that question. If you really did good. If you're a failure, just say I don't think anyone remembers me.
So then there is one question. Probably Dr. Eman could answer this one. The audience wants to know, how to apply to the summer elective program at hospitals. Like, is there an application form for students, to apply to plastic surgery electives during the summer?
I think every hospital has its own policy, and you can ask the academy, academic training. They will give you the email, and they will instruct you if they have positions and the available numbers and what the thing that is needed. It's different from hospital to another hospital.
Okay, thank you. So I think this is the last question for our interview. And I think this applies to both our speakers here, Dr. Mrad and Dr. Eman. So any last thoughts or advice or words of advice for our audience?
Let Eman, you start and I'll answer after.
Sure. First of all, I will give advice for the unmatched candidate. You can do clinical attachment in a plastic surgery, or works as a surface plastic surgery resident, which is, I think, available in Al-Shmaisi and the National Guard Hospital. Also try to do more research and study for SMLE to try to get higher score, and also try for interns and unmatched resident. Also try to present a poster or oral presentation in an international conference, volunteering in health public activities, and I think that's it.
Okay. My advice is more general than this. Excellent advice from Eman. I really appreciate it. Really appreciate you being with us today, although you're on call. My advice is very general. I want people to enjoy their life, okay, throughout their career, throughout their residency, throughout their university years. Alhamdulillah, I loved my school when I was in school. I loved my university when I was university. I loved my residency when I was in residency. I loved my fellowships when I did my fellowships. I love my job now. It was always, alhamdulillah, this is a blessing. So you need to be intent inside, okay, before trying to run this war or, you know, this busy life. I remember when I used to go to my exams at the university, King Saud University, all my colleagues are stressed and, you know, in tears or anxious, or I know personalities differ, but I used to go in smiling, happy, making jokes, and come out the same way because I did my part and the rest is God's will. I studied well. I studied all night long. I studied all summer. You have to do your part, and then the rest is written. You don't need to worry about it so much. Similarly, in residency, I applied for my fellowship. I applied 3 times, and I was rejected twice. And alhamdulillah, the 3rd time, I got accepted in what I did. So you need to keep on at it and try. I had some tough times, I must say. When I applied for my residency, it was a bit tough, and that's what you guys are applying for now. But try to enjoy the journey more than stressing about it. Or inshallah, God will give you the best in your life and what you are capable of doing in the best way possible, inshallah.
Thank you so much, Dr. Mrad and Dr. Eman. I think those are beautiful and very valuable words of advice and wisdom for our audience. There is one more comment from Dr. Shahad Al-Munai. I'm sorry if I'm mispronouncing your name. She says, thank you, Dr. Murad, for your time and advice. It was very informative and enlightening. And thank you, Dr. Eman, for sharing with us your experience.
Yeah, thank you.
This resonates all the best. So in the end, I'd like to thank Dr. Murad and Dr. Eman for taking time out of their busy schedules, and mashallah, Dr. Eman is also on call, for joining us today in this webinar, in this short interview. I think a lot of these burning questions have been answered for our audience, and inshallah, we will also be posting this on our Alfaisal MedHub YouTube channel so that it reaches far and wide. And please feel free to share this with your colleagues who may benefit from them. And I think the advice that was shared over here does not only belong to plastic surgery residency. It applies to almost any specialty. And definitely the ending words of wisdom from Dr. Murad, I think, applies to everything in life, not only surgery residency or any residency for that matter. I think what is important is that you love what you do and you do what you love. So definitely, I think it's been a wonderful time, that we spent with both of them today and with our lovely audience. If there are any ending questions, we may be able to take them, maybe 1 or 2 more questions before we end this webinar. If not, then, we'll say our thank yous and byes for the final time.
Let's say our thank yous while we're waiting. Thank you, Ismail, and everyone who worked on this. I have many names that sent emails to me to make this happen. This is a great initiative. I hope all universities would have this. And thank you very much. And thank you, Eman, for accepting this invitation as well on a short notice. We're waiting for Osama Junaid. He said I have one, but he went quiet after this. It's like messages that I get from patients sometimes. Assalamu alaikum. Assalamu alaikum.
And then nothing.
And then nothing, you know? And then I say wa alaikum salam. And then it's another quiet. Kif halak? And then what? You know? Just say it. So then it goes. What's for non-Saudi?
Yeah. So what's for non-Saudis to be accepted in the program if they fulfill the requirement? So basically he's asking, is it possible for non-Saudis to be accepted if they fulfill the requirements?
I don't think there are, you have to check with the Saudi Council, but I don't think in plastic surgery we have seats for non-Saudis for the time being, because we need to train Saudis to cover the basic needs of Saudi Arabia, and maybe in the future they would have positions for people from other other nationalities, or even from abroad to apply and learn in Saudi Arabia. So to my knowledge, in plastic surgery we don't have that. I'm not sure about other specialties.
Okay. The other question says, are applicants from other cities at a disadvantage compared to those from the same city?
Not at all. Not at all. Eman is from Hayl, if I'm not mistaken. She studied in the University of Hayl, and صح Eman?
Yes. صح.
And she got accepted. And the other applicants were from Riyadh or Jeddah, so it has no means of part of that application.
Okay, and I think we'll take one final question. Maybe Dr. Eman would answer this better. How can I approach a letter of purpose?
Letter of purpose, it's not requested, and if it's the same of letter of recommendation and or letter of reference, you work with the consultant, and after by the end, and if he knows you well and you do well, ask the consultant kindly to take a reference letter or recommendation letter, and then he will give you this recommendation.
Well, I think, thank you, Eman. I think the letter of purpose is like a summary letter at the beginning of your letter or before your CV. It's not needed in applying in Saudi.
Yes, it's not needed for Saudi program. It's for abroad.
Abroad, you might need it.
This should be written by yourself. You wrote why you choose this specialty, and you show your interest, and it should be special and written by yourself.
Yeah. Well, always, please check the grammar and check the spelling in your letters. That is a very big mistake in your CV or letter of intent or letter of purpose. If you have mistakes, it tells me something. It tells me that you're not a detailed person. You're not. It's something embarrassing, Salaha. You know, if you're not good in English, it's okay. You can send it to someone who's good in English, a colleague. You can let a nurse read it. Anyone who can help you write this. And there are, I think, websites that can help you with that as well.
Hi, hello, Dr. Mrad. Thank you so much for this talk. It's amazingly beneficial. I've been a fan of you for so long. I've followed your career and I've looked up to you since the first day I knew about plastic surgery. My name is Shahad Azz. I just matched in plastic program in Jeddah. And one of the requirements is a letter of purpose. I'm just not sure how to approach. Should I go more emotional, or should I make it like a professional summary of my CV and what have I done, which campaigns, which doctors I worked with? Or should I go more, this is why I want plastic surgery, and what made me love it, and what the cases that I've seen that changed my outlook on life in general and on medicine specifically. What do you think? Which would you respond to?
Maybe this is something new. Last year, I've never seen a letter of intents from residents. At least, I think in the past 2 years, I haven't seen it. So maybe it was there before and now it came back. It's definitely outside, like Eman said. Like I said, be honest. Write what you really want to write. Don't go and follow someone else. Don't write something that is not real. Of course, don't write something that is. Don't imagine a story in plastic surgery and come and write it to me. Write something that is true to you, and it's the first thing that comes to mind when you want to write this letter. You know what I mean? Don't think, should I write it emotional? Should I write it serious? Should I be? Just write what you want to write. Write it. Write in all honesty what you think is good to be written in that paper. You know what I mean?
Yeah. Thank you so much.
You're welcome. You're welcome. Cool.
Thank you. So I think that would be our last question for this webinar. So again, thank you so much, lovely audience, for participating and engaging with our speakers for today, Dr. Mrad and Dr. Eman. And again, Dr. Mrad and Dr. Eman, thank you so very much for accepting this invitation, for taking time out of your busy schedules and joining us for this webinar. We really appreciate it, and we're very honored to host you today. And inshallah, we look forward to having you again in subsequent webinars, inshallah.
Inshallah, anytime. Thank you very much. Thank you, Eman.
Right. Thank you so much. Assalamu alaikum.
Nasa.